With loving concern for our association members' safety during the pandemic, on August 27, 2021, our most beloved Supreme Master Ching Hai shared her caring advice along with some extra remedies as precautions against COVID-19 and its even more dangerous emerging variants. Master also asked us to share this message with the world as a help in these still uncertain times for all.
This is just a reminder for all of you wonderful souls. There are quite a few variants of the COVID, but Delta seems to be the worst right now, even though there's another new one, but the scientists say it's not as bad as Delta.
The Delta variant has been driving a surge in cases. Countries are grappling with new infections and growing hospitalizations, with breakthrough infections observed among the vaccinated. The South Korean study has found that people infected with the Delta variant have a viral load 300 times higher than those with the original version of the coronavirus. Now, higher viral load means that the virus spreads far more easily from person to person, this increasing infections and hospitalizations across the globe. Epidemiological research also suggests that the Delta variant is at least 40% more transmissible than the Alpha variant. Studies have suggested that fully vaccinated individuals remain vulnerable, with the breakthrough infections becoming more and more common.
Delta is the most transmissible of the variants identified so far.
The CDC now says that Delta variant is more contagious than the common cold, than chickenpox, even Ebola. And new data shows that the viral load is the same in infected, vaccinated people as people who have not gotten their shot, meaning vaccinated people are still contagious.
Delta variant is spreading in more than 2/3 of all countries
and Western Pacific nations. Over 6 million people across the region have been infected, with Indonesia, the Philippines, and Malaysia having the highest number of cases.
Surges are pushing health system dangerously close to what we call the red line.
More than 100,000 people being treated for COVID in hospitals in the country right now.
New South Wales children and teenagers account for 30% of infections. In Victoria, it's a staggering 45%, with research showing children are particularly vulnerable to long COVID.
Another alarming number, children in the hospital right now, 2,100 kids in the country, the highest numbers in a year.
Delta will be causing more severe diseases and may have a long-term impact that will affect children for many years to come.
We are going to be in COVID world for the foreseeable future. It's actually not clear what the end game will be. And the end game may be worse than where we are now, because there's no guarantee that Delta is the worst variant we could possibly see.
If you read the news everywhere, people are getting it easier and quicker than before. Even people who are vaccinated, double already, still get sick and died also very shortly afterward, including children. Before, children were more or less spared of this COVID-19, but now the Delta doesn't spare anyone and it spreads so fast. Even with the mask and face shield and all that, if you stay too long in a room with many people, especially if someone is sick in there, you get it. Maybe you got it, but you don't think you got it because you are asymptomatic, okay? Apart from all the precautions, you must always be humble, be grateful that you're healthy. Pray for your safety, pray for protection, okay? If you have this kind of arrogant attitude, like, okay, I'm vegetarian, I'm vegan, I'm raw, whatever, and I won't get it. No, you might. Because the COVID-19, especially Delta, they have souls, I told you already. And they know everything, they hear everything, they will find you. So you might get it, even if you're vegan or raw or whatever. Especially if you are telling other people, misinforming them that, okay, you have to be this, you have to do that, you don't care, you don't need to wear masks because it's unhealthy, because you keep thinking of sickness. No, you don't have to think of sickness. You don't have to think that you might get it, you just be cautious. Cautious is always healthy. Because if you get it, you might transmit it to other people, family members and all that. It's not cool. Yes, because maybe you get it, but you are kind of an asymptomatic person and you don't know it and you keep boasting a lot and you go everywhere without a mask or without, precautions, then you might get it. Many people make fun of people who recognize COVID and deny the COVID is anything important or serious. They all die. It's all in the news, old, young, whoever. You cannot have disrespect for this kind of virus. If you happen to be in a crowd somewhere, like an airplane, even though before they say it's very seldom you get it, the chance is very hard to get it by traveling in the airplane. But now people get it everywhere. And the death number spiked up. And the children's infected number also spiked up, not like before. And the children's death also spiked up. Many hospitals, many state hospitals are full. Some people are not accepted to go in the hospital, even though they're very sick. So if you are sick and you are in the hospital and get taken care of, you count your blessings. Thank God, thank heaven for that. I'm giving you some of the extra prevention or extra cure medicines and tips if you'd like to try. Take them between any kind of your prescribed medicine, not together, at least 30 minutes after. If you have it or if you can crush some fresh garlic and take about 1 teaspoon twice a day, 12 hours between. If you don't have fresh, you can take dry garlic powder also, similar amount. It will also be effective. And you can also take like vitamin D2 or D3, vitamin E, and of course the multivitamin with meals. Okay. Hope these things help you. If you have to travel long distance and have to mingle with other people, like in an airplane, for example, before you go, you take all of this. Of course, it won't smell nice, but after that, you drink something, you eat some mint to dilute the smell of the garlic. Also, there is a flu concoction that I have taught you before. It's still on the internet, in maybe our cookbook or something. So take that and all that vitamin and garlic before you go. Better when symptoms just start. If a symptom persists after 2 days, you should consult your doctor. All this is for prevention and extra boost for recovery, not to replace your doctor's prescription for infection. Always consult your doctor with symptoms don't ease. You can also take pure lemon juice, 1 teaspoon twice a day. All that might help you more than just nothing. Even if that won't help, it's no harm, at least no harm, okay? Important thing is you must be humble. You cannot have a careless and arrogant attitude. You think that like raw food will protect you. No. It's not that. It's maybe that your karma is better. You still have some good karma left, plus God's blessing. But if you mingle too much with many people, you get it. Not because the virus doesn't spread as fast if you get out fast, but because you mingle with too many people, different energy, maybe very low level spiritually, then you'll get it. Because your karma might not be enough to cover. Maybe you're not humble enough. God helps those who help themselves. So don't just rely on God or heaven alone. You have to take care of yourself also. God cannot eat for you, see? God cannot drive your car, see? God cannot wear the clothes for you. You have the physical body in the physical dimension. You have to take care in the physical world, in the physical way. And God helps, of course. You must pray all the time. Remember the 5 holy names. And do not think that you are a good practitioner and all that and you won't get COVID. No. You might not be as good as you think. If your karma is heavy and you don't practice well every day to protect yourself, then you still might get it. Not just COVID or Delta, it might be something else. Always be humble, grateful, and pray for protection. That's all you can do. If you still get it, then that means you cannot avoid. The meat and the eggs and the fish before come chasing after you. The Delta is really looking for the people. It's really tracking people, tracking those low-level people to infect them. So make sure your level is high. Make sure you meditate well also, okay? Vegan is not enough. Better than animal eaters, of course. But there are many factors involved. Mostly vegan people, if they're pure and humble also and repentant, they will be more protected. But vegan alone is not 100% protection, okay? It is a big protection, bigger than people who eat animal blood and flesh. But still, our attitude, our sincerity, our purity also has a big influence, because the karma we carry around, we attract different kind of karma and mix together with them in the public, where there are so many different energies and mix matching, low, high, and middle. You never know who's who. That will also bring you infection. The people who don't get it yet, don't talk too loud, don't be too proud. Even I don't dare. If I happen to go out somehow, I wear a mask. I mostly wore it before the pandemic even. I have been wearing it whenever I can, if I go out and mix with people. Except with the disciples, I wear less, I care less, because I cannot wear the mask and shield and all that. They cannot see me, and I cannot talk very well. But when I go outside, like before, long ago, like a shopping or anything, I try to wear a mask. When I travel, I wear a mask. Even when at home, with other people, I also wear a mask. I say, in case I'm sick and I might transmit it to you. And people around me who work from a long time, or in the restaurant, I always advise them to wear masks. And also wear gloves and all that. Just to protect each other, yeah? We do our best. And heavens do the rest, okay? Do not be so arrogant, so self-conceited. Then you might be in for a big surprise. A surprise is not always nice. Okay, take good care of yourself. We are in a big, big problem right now. I mean, the whole world. One variant after another. This Delta is very strong. So many countries already opened, thinking the pandemic is gone down. But in many places have to close down again, because this Delta is really devious, very, very bad, very evil. So don't take everything for granted, okay?
Another patient arrived by ambulance has gone to the resus area.
It's quite a sad story. His wife died on Friday of COVID while he was being treated in here.
Oh my God. Now he has dangerously low oxygen levels.
You hear so many stories about having it, and I was just thinking, this is way worse than I imagined it to be. You're like, oh my God, I can't breathe. Felt like weights were sitting right here on my chest. Like I could not get barely any air in. I had the biggest headache. It felt like my head was like a hot air balloon. I was just gonna explode.
It feels like you've only got 20% of your lungs working.
A lot younger this time. We lost people in their 30s. I remember thinking that could be mum, that could be my aunt, and now I'm thinking that could be me, that could be my brother, my boyfriend. So yeah, it's hard.
I was really taken back by how many people were so debilitated, like not just physically, but we deal a lot with the cognitive side of things, and we'd have patients who were like hugely, independent, like running their own businesses, lawyers, who actually were really confused and couldn't manage to do basic tasks.
I've never hurt like I've hurt. It's made a believer out of me.
Probably should have had a little healthier fear that would need to be taken more seriously. Because I mean, I don't know how close I am to being a lot worse. I really don't know.
Christopher Green died 9 days after this interview.
Most disciples are safe, except those who are low level or don't take good care or eat wrong things that they don't even know. Eat things that are not pure or mingle with people who are not too pure, too often or too long, then can also get sick. Do not try God. Do not try heaven. Any initiation, small number, spread out and outdoors, not inside rooms. Take care of yourself. Be humble. Be prayerful. Be grateful. All the time. All the time. Even if we don't have a pandemic, always be grateful. Be humble. The flu concoction that I have made before, a long time ago, is for mild case. It could help very quick or for the beginning of the infection. If it's long-term already, it might also help, but probably less noticeable. You can try, it won't hurt. It won't hurt at all. The garlic might smell bad, but you can eat some mint leaves or something afterward. Drink some vegan milk with mint, peppermint, or tea with peppermint to dilute the smell. Then it's okay. It's not quite okay, but this can help you to feel better. It won't harm you in any way. There's no side effect. But don't take more than advised. Like vitamins, you take according to the dosage or according to what the doctor tells you. Like garlic and all that, also take it moderately. Even if you have good karma, but if you mingle too often with different people who have heavy karma, then you will share their karma and then you might get it as well. Maybe not too heavily infected. Maybe you think it's just a headache or something, but if you see any symptom and you are suspicious, you must go see a doctor. You have to go test. You cannot just say, oh, because it's raining or because it's a cold day. No. You must go test before it's too late. If you know it earlier, it's easier to cure, okay? Yes. If you know it earlier, even the garlic or the flu concoction would even cure you with isolation, 3 weeks, of course, minimum 2 weeks. But if it's already been long and you don't even know it, or you think it's just a normal common flu and you let it be too long, then it's very difficult to get well, to heal, because your lungs may be damaged, or your heart, or even your brain. It might damage one of your inner systems, inner organs, and then it will be difficult to cure, or it might damage many organs together. Depends on how bad it is, depends on the numbers of virus that you got from others, okay? The numbers of virus is very important also, because sometimes you get not too much, then you won't feel too bad, and it's easily cured. That's why you have mild symptoms. But if you have gotten a lot, big amount of virus, then it's very difficult to cure. It could be deadly also. So be very careful, okay? Don't take everything for granted. We all have bad karma, so must remember that. Be well, be safe. Thank God. Love you. Love all of you. God bless. God bless you. God bless our world. God knows. God knows how hard it is for everybody at the moment. Without freedom, without jobs, without security, without guarantee about anything. Just because our planet is truly in trouble right now. It's getting faster and faster. I'm really worried for everybody. But what can we do? I do my best. You also, okay? I do my best to help you also. Take care. God love. Okay, that's it for now. Best of luck to all of you.
Our heartfelt appreciation for gracious Master's precious and helpful advice on how to protect and care for ourselves, as well as those around us. We sincerely pray for this unsettled period to end soon, and primarily for the world to turn to the preventive vegan lifestyle as the quickest and only long-term solution for all such unfavorable circumstances on our planet. May Master be in the best of health and protection, accompanied by the love of all benevolent divinities. All of Supreme Master Ching Hai's tips for protection during the COVID-19 and any other pandemic are free for viewing and download at masterstipsoncovid-19.com.